Is it possible that when you exhume someone, you can find blood? That is number one. Because of time, we are going to short very soon. The second one would be, uh, can autopsy determine, even after burying someone, that this fellow died from maybe suicide or murder, something like that? So I have joining me online today Dr. Sebastian Omenaj. He's a pathologist, a consultant pathologist, and a senior lecturer at Edo State University. First of all, what is autopsy? When people hear the word autopsy from a professional standpoint, what would you want them to know?
Okay. Autopsy, also known as a post-mortem examination, it's a specialized procedure, more like a surgical procedure.
Mm-hmm.
It is used to determine the cause and manner of death, basically. So you are looking at what killed this person and how did this person die. So it involves some dissection, just like surgery. And you can say the origin of the word autopsy
Mm-hmm.
is Greek from the word autopsia,
Okay.
which means to see for oneself, meaning that you have to see for yourself
You have
what
to see
happened.
for yourself what happened. Okay. Now, my next question would be, in what condition should one request for autopsy? Does there need to be a special case and say, oh, now I want autopsy, or anybody could just say, I need an autopsy?
Okay, thank you. That's an interesting and very important question because there are two types of autopsies per se. We have the hospital request,
Mm-hmm.
and then you have the coroner's autopsies. The hospital request can be for medical knowledge, just per se,
Mm.
meaning someone with a known disease dies, and for sake of science, the family can grant permission to have an autopsy on that body just to explore the disease effect on the body. That's a different case.
Mm.
Then you have the medical legal autopsies, which are the coroner cases or medical legal autopsies. There are indications for them.
Mm.
So one of them is violent death. So someone died by homicide, suicide, accident, road traffic accident, or any injury. That falls within the medical legal system. Then death that are a public health risk, like suspected poisoning, occupational diseases, and like when the COVID case or you have some cases that are of public health importance, are also cases that autopsies are required by law.
Okay.
Then when the physician
Mm-hmm.
cannot issue a death certificate, meaning that somebody comes to the hospital,
Mm-hmm.
this, the doctor that attended to the person cannot issue a medical certificate of the cause of death,
Mm.
meaning that the doctor does not know why the person died.
Mm.
In that case, autopsy is required by law. So you see that there was no doctor when the person came to the hospital
Mm-hmm.
where he died, or the doctor did not see the person in the last 10 days in his or her clinic, that means a new patient. Then the patient spent less than 24 hours on admission in the hospital before the person died. Or after the person has been in the hospital for a few days, investigations done so far did not provide any diagnosis. It's also falls into the realm for medical legal autopsy.
Medical legal autopsies. Okay, let's go to this specific case on ground right now. I know we don't have more details, but we saw on social media that when he was exhumed, there were blood stain, and
Oh,
people are wondering, oh, this and that. Now, so my question would be: is it possible that when you exhume someone, you can find blood? That is number one. Because of time, we are going to short very soon. The second one would be, uh, can autopsy determine, even after burying someone, that this fellow died from maybe suicide or murder, something like that? So we have two questions together in one.
okay. Just to quickly summarize, yes, the body that died still
Yes.
has blood in the system.
Hmm.
So you can have blood.
Hmm.
And part of the system for decomposition will be fluid and blood coming out either from the nose or the mouth.
Hmm.
So if this case where the head was squeezed into the casket, you can have that oozing coming out and staining the casket. So there's blood in the body that will still come out after some days. So this case, that blood you see is actually post-mortem and it's ruling will not be of anything. It's not strange to find blood in the body. And yes, you can still make out the cause and manner of death of the individual after exhuming the body and conducting the autopsy. I'm sure my colleagues who have handled the case will eventually provide everything in their report because what they need to see and examine, they will still see and examine.
They will still see and examine. My last question, sir, would be how long does it take to get results of autopsy? Maybe there are special cases, but in this case, how long should we be looking at?
Okay, fine. This is a case that I would think that people should not be in so much hurry to start asking for
Yeah,
the final report.
yeah.
To do the autopsy itself, the procedure can take between 3 to 4 hours, and you are done.
Mm,
But that is not the end of the autopsy.
yeah,
Subsequent testing will be done. Some samples will be taken to the lab. All this will have to come back with different results. And I am not involved in the case, so
yeah.
I do not know what they found when they did the postmortem examination
Mm-hmm.
and the extent of subsequent laboratory investigations that will be done.
Yeah.
But you'll be looking at having a detailed report within 4 to 6 weeks.
Any final words, sir, as we round up because of time? Any final words from your
Okay.
side to advise
Okay.
Nigerians? Yes.
Okay. If I will use this case as an example, I will say that
Yeah.
it is very important that Nigerians should know cases that fall within the medical legal frame for autopsies, so that there is no need to rush and bury an individual where that case will be under investigation, like happened in this case.
Yeah.
There are so many deaths that are actually probably homicides that get unnoticed in this country
Yes.
just because people rush and bury the
Very.
disease. And sometimes autopsies provide closure for the family.
Thank you very, very much. Thank you so much, sir.
All right, thank you
Thank you very
for
much.
having me.
Thank you very much. You just listened to Dr. Sebastian Omenaj, consultant pathologist, senior lecturer at Edo State University. It's an honor to have him on the program with us today on the Health and Safety Cafe. Thank you. We'll be going on a short break, and then when we come back, I have very interesting guests with me in the studio to talk about a very, very, very important product that would help you. Don't go anywhere. This is the Health and Safety Cafe.